there. I am Dr. Leslie Sharp, board-certified emergency physician and professional photographer, and I am here today to teach you a little bit more in my 2-minute emergencies. My topic for today is nosebleeds, and I thought I'd give you a little bit of information that might help you if you ever have a nosebleed in the future. So, number one, what causes nosebleeds? One of the most common things that causes nosebleeds are simply dryness. So if your nasal mucosa, or the lining of your nose, becomes very dry, the smallest amount of irritation can cause your nose to bleed. Now, that can be even in the hot weather, the cold weather. It's more common in the winter months when you go into those dry environments where you don't have the same amount of humidity in your home. But it can happen just as easily in the hot summer months. So another hot reason or main reason of causing your nose to bleed is if your blood pressure is high. Now, having elevated blood pressure puts extra pressure, as you can imagine, on those blood vessels in your nose, causing them to bleed. And this is especially common in people who have heart disease and are on medications called blood thinners. So how do you prevent, or what can you do to stop a nosebleed once it starts? A lot of people have heard a lot of myths on what to do. Now, number one is, just like any other wound that is bleeding, you want to hold pressure on the site. Where do you hold pressure? What's the best place? If you feel your nose and feel the bone right here, you go just beneath that bone, and that's where you apply the pressure. Applying pressure, the idea is to keep it consistent for at least 5 minutes. Do not check your nose to see if it stops after 30 seconds. Chances are it won't have. You get frustrated and you think something more serious is going on. Holding your nose with steady pressure, enough pressure that it actually hurts. If you're not hurting and your fingers aren't going numb, as I always say, you are not holding your nose tight enough. So that's one of the keys to stop your nosebleeds. A lot of people tend to put tissue up their nose. That's not really doing anything. Sure, the bleeding will stop eventually, and you'll remove those, and many times the bleeding will start all over again because you formed a clot on the other side of the tissue, which once you pull the tissue out, you've pulled the clot out. Another thing people tend to do is they tend to hold their head way up high. All that does is make that blood, instead of it coming down your nose, it's going right through the posterior part of your nose and down your throat. No one wants to swallow their own blood. First of all, it tastes horrible. And number two is it can upset your stomach if you swallow enough blood. Blood is obviously meant to be inside the blood vessels and not outside in your stomach. So definitely don't want to do that. You don't need to hold your head down too far either. If you just keep it steady, straight ahead, that's the best way. So some of the things you can do to prevent having nosebleeds is, one, manage your blood pressure properly. If you're supposed to take blood pressure medications, please take them. That is the safest way. Number two is make sure you keep your nasal mucosa, or the lining of your nose, moist. If you know you're going to be in a very dry environment, you can there are several over-the-counter products that you can buy to help keep your nose moist, or you can use just simple nasal saline spray. You can buy it over the counter at any drugstore, and all it is literally is salt water. There are also other products on the market which are simple lubricants that you can use in your nose, which are a blessing for people who have frequent nosebleeds. So that was my tip for today. I hope you enjoyed it. I hope that you keep some of these emergency conditions in mind and help to keep safety in mind as well. Now, if you have a nosebleed that lasts for longer than 5 minutes, try a second time, holding it longer the second time for 10 minutes. At that point, if your nosebleed has not yet stopped, it may be time to seek some medical professional help. So that's my tip for today. Have a wonderful rest of your day. Take care.